Hello everyone and welcome to my YouTube channel. In this video we are going to learn about the cranial nerves and the skull foramina. So before going to start our video, if you are new here, please don't forget to subscribe to my YouTube channel, that is Dr. Shrikant Kadam, and the other channel that is Medically Creative. This channel is specifically for medical content. And on this channel I put some creative videos like guitar videos and some videos related to books. Okay, so with this note, let's begin our video. So here there are 12 pairs of cranial nerves and they exit the cranial cavity through foramina or fissures. Okay, so what are these 12 cranial nerves? These are olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial, vestibulocochlear, glossopharyngeal, vagus, spinal accessory, and hypoglossal. Okay, so out of these, the first one, second one is sensory, then third, fourth, and sixth, these are motor, then the fifth, seventh, ninth, 10th, these are both, that is mixed now, they are both sensory and motor. Then the vestibulocochlear is pure sensory, then the 11th and 12th are pure motor. Okay, so now here all the cranial nerves innervate the structures in the head and neck. Okay, so they exit through the cranial cavity and they innervate the structures in the head and neck. Out of these, the only one now, that is the vagus now, it is a notorious one which descends through the neck into the thorax and abdomen where it supplies the viscera. Okay, so this is the only one now, that is the vagus now, which not only supplies the head and neck but also supplies the thorax and abdomen. Okay, so now the autonomic nervous system. The autonomic nervous system is divided into two parts, that is the sympathetic one and the parasympathetic one. So the sympathetic outflow is by the thoracolumbar spinal nerves and S2 to S4 sacral nerves. Okay, and in parasympathetic these are third, 7, 9 and 10. Okay, third, 7, 9 and 10. Now we will deal with the skull foramina. These are, the central part is the foramen cecum, then this is the crista gala, then this is cribriform plate which has pores, like it is a sieve-like structure. It is a sieve-like structure, and we will deal with the structures passing through these foraminae later on. So this is the cribriform plate, then this is the optic canal, then this is superior orbital fissure. Now here is the foramen rotundum, this is foramen spinosum, this is foramen ovale, then this is foramen lacerum, this is internal acoustic meatus, then hypoglossal canal, then this is jugular foramen, and this is foramen magnum. Okay, so these are all the foramina of the skull. You should remember this because this is very important. The questions has been asked from this topic that which structures pass through which foramina. Okay, so this is very important. Now this is again the diagram of the same, that is this is the optic canal, this is the superior orbital fissure, then this is foramen rotundum, this is foramen ovale, then foramen spinosum, and the middle part is the foramen lacerum, and here is the carotid canal. Okay, so now we will deal with the structures passing through these foramina. So this is the cribriform plate, as we have already talked about, that it is a sieve-like structure. It is a sieve-like structure through which olfactory nerves pass. Okay, through which olfactory nerves pass. So next, this is the foramen cecum, the anterior one, through which emissary veins to the nasal cavity passes. Okay, so through which emissary veins pass to the nasal cavity. Then superior orbital fissure, this is the superior orbital fissure through which the third, fourth, the first division of the trigeminal nerve passes. Next, the abducens nerve, then superior ophthalmic vein passes through this superior orbital fissure. Then foramen rotundum through which maxillary nerve passes, that is the second branch of trigeminal. So the first branch of trigeminal passes through superior orbital fissure, the second branch of trigeminal nerve passes through foramen rotundum, the third branch of the trigeminal nerve, that is mandibular nerve, and which passes through the foramen ovale, and here is the mnemonic for the foramen ovale, that is male, M-A-L-E. So M is for mandibular nerve, that is the third branch of trigeminal nerve, then accessory meningeal artery, lesser petrosal nerve, and emissary veins. So these are the structures passing through foramen ovale. Then foramen lacerum. So this is the foramen lacerum through which the greater petrosal nerve and deep petrosal nerve passes. Okay, next, this is jugular foramen. So through jugular foramen there comes this inferior petrosal sinus, glossopharyngeal nerve 9th, the vagus 10th, accessory, the spinal accessory one, that is 11th, the sigmoid sinus, and the posterior meningeal artery. Then this is hypoglossal canal. through which obviously the hypoglossal, that is the 12th nerve, passes, and then again meningeal branch of accessory pharyngeal artery passes through this. Okay, then foramen spinosum, here is the foramen spinosum through which middle meningeal artery and vein, meningeal branches of the mandibular nerve passes. Then carotid canal, the internal carotid artery and nerve plexus around it. Okay, so internal carotid artery and the nerve plexus around it passes through this carotid canal, this one. Next, then internal acoustic meatus. So this is the internal acoustic meatus through which the facial, that is the 7th one, and the vestibulocochlear 8th one, and labyrinthine artery passes. Next, and this is the foramen magnum, and here ends the brainstem, or there is beginning of spinal cord. So spinal cord passes through foramen magnum. Now just see the origin of the nerves and how they passes. Okay, so the olfactory and optic starts from the forebrain. So the olfactory and optic starts from the forebrain. Okay, so here is the olfactory anteriorly, the first one. Then here is the optic. The first and second starts from the forebrain. Then third and the fourth, the oculomotor and the fourth one, which is dorsally present, right? So this is the ventral part, so fourth is not visible on the ventral part, so it is dorsally. So the third and fourth originated from the midbrain. Okay, now the fifth one is from the pons. Then 6, 7 and 8, the sixth one, the 7th and 8th, the 6, 7 and 8, they are from the pontomedullary junction. Okay, so they arise from the pontomedullary junction. Then, so this central is the pyramid, this one is the olive. So the 9th, 10th and 11th, they originate behind the olive, and the 12th one originate anterior to the olive. Okay, so this is all about the cranial nerves and the skull foramina. Thanks for watching. Keep reading, keep inspiring.